Hi, everyone. Tamara and I wanted to get on our weekly Zoom tonight, and we thought it would be beneficial to kind of go through some kind of Q&A, some common things that people ask us in the clinic and message in and ask us, about LifeWave patches tonight. So that's what we're going to do for you all. Some of you may be new to patches, so we're going to kind of just do a brief overview. Others of you are already wearing patches. And so I think this will be a good review and maybe some added info for that. So I'll start with LifeWave, which is a company that was founded about 20 years ago. David Schmidt was the lead researcher, and he holds patents on these patches. The patches are basically a reflective material. There's a crystal matrix in these patches that reflect your body's own energy to produce a biochemical response. So the cool thing about this, and kind of the unbelievable thing at the same time, are that these patches are not putting anything through your skin. They're basically, think of it like your body's own tune-up of systems that maybe have gone awry or become deficient. The foundation patch is called X39. This is kind of the pouch that they come in. There are 30 of these patches in this envelope. And they look like this right here. Camera's a little, got to get it just right. Not sure why that is. But there we go. Yeah. Anyway, they look like just a small disc. You peel the backing off of the patch and then place it either under your belly button or on the back of your neck and wear them for 12 hours. So Tamara, with that, can you kind of lead us off with some of the main, we'll kind of tag team, but knowing that we will wear those patches 12 hours on and 12 hours off, what other questions are you having about the 39?
So some of the common questions are, what if it irritates my skin? We do deal with people in our population that maybe have some sensitive skin issues. Also, like, what if I forget to put it on, or what if I forget to take it off? I think those are probably some of the top things that I run into that concern people. But like you said, there's no like medicine that's being put into your system, so there's no worry about like, oh, I've infused myself with too many ingredients, because that's not the way that this works. So it's okay to be wondering about those questions, but you don't have to be fearful about them.
Okay. So knowing that, if I did have sensitive skin, what would be a solution?
So you can just simply put it on the clothing in that same area that you want to wear the patch in. It is activated by your body's emission of that red light and that temperature change. So it's perfectly acceptable just to flip that and put it on your clothing instead of on your skin. I know that I am probably going to opt to do that during the summer when I'm in swimsuits and I'm worried about sweating it off, things like that. So that's another option there. And then if you forget to take it off and you wake up and you're like, oh, darn it, I had that on for 24 hours, you just take a day rest. You just take a day and leave that off. If you forget to put it on, just try to get back on that cycle of 12 on and 12 off as soon as possible.
Okay. I know, like, my husband, being a guy, was more like, hey, more is better. Can I wear this thing for 24 hours? Wow, I think it'll help me more. When he did that, he noticed that it was way more effective in his sleep and his energy and the way he felt when he respected that 12 hours on, 12 hours off. So, not harmful if you forget a day, but we want to maximize the effectiveness. And all the studies have shown us that 12 hours on and 12 hours off produce our most drastic and incredible results. So, Tamara, the X39, what does it do? Like, so it's not putting a chemical in. Can you explain to everybody what's happening?
So we're increasing 3 different peptides that are already in our body. So we're not giving ourselves anything that we don't already have. What we're doing is we're harnessing those ingredients that are already circulating through our system. We're combining those to create a copper peptide. And so through creating those chemicals that are already free floating in our system, no additives, our body's just able to kind of grab all of those free radicals, combine them, and then use those to our benefit. And so the benefit is we're starting to turn on that process of our dormant stem cells. We're going to just activate those stem cells that are already within us, our healthy ones that want to be used, and our body just doesn't have that energy source to tap into that potential. All we're doing is just turning that switch on.
So, one of the other common things that people, ask about, they want to know longevity. Like, do I have to wear this thing forever? Can I take a month off? What would you tell them about that part?
So, it's like think about swimming upstream. As long as you are swimming, you're moving. And as soon as you stop swimming, you're going to start to drift back. So, same concept with the patches. Once we activate our stem cells, once we get our body working for us and healing all the things and giving us the benefits that we want to see from these patches, we just want to keep that benefit going. And if you're like, hey, I'm happy with the benefits I got, but I don't want to, have these same benefits, and longevity with these benefits, then you would stop the patch and you would start to see those results fade.
I know too that one of the main things is knowing that you have to wear it every day. So you
Yes.
don't want to have these big lapses and that type of thing. So, how do you remember to put this thing on every day, and how tedious is it?
So, for me, it's pretty simple. I just keep it as easy as possible. I brush my teeth every single morning before I leave my house, and I brush my teeth every single evening, which is about 12 hours after that first patch goes on. So every morning I brush my teeth, put the patch on. As soon as I do that, it's sitting right there. Boom, brush, patch, and it just becomes that routine. It takes me maybe all of 5 seconds to grab it, peel it, stick it, and then same thing in the evening. Oh, okay, that's time for that to go. I do travel with like camping in the summer quite a bit, so they just go with me when I camp, keep them in a cool environment. I'm on the same schedule, so it's really not tedious at all.
Some, I know too that, with the benefits of these and all of that, there are some supplemental patches. So typically, we recommend in the clinic, and we've patched dozens and dozens of patients, and not including friends and family at this point. I know that we typically start them on X39. That's the flagship stem cell rejuvenating patch, if you will. But there are some supplementary patches. And would you talk I think it's important for people to hear about Icewave, because out of all the patches that they have created, second to the X39, the most impactful immediate patch is that Icewave patch. Can you explain that to everybody?
Absolutely, yeah. So that's one that we use in the clinic. I would say at this point, honestly, Rhonda, probably daily. I mean, I can't think in the last week of a time where I didn't say that ice wave patch is going to help treat somebody's pain and it's going to be an immediate response. So it is a pretty simple patching system once you understand the way to apply it. Essentially, it's just disrupting the pain signal. So if I have elbow pain, I'm just going to get in there and put a patch on one side of my pain, toggle around until I figure out what is the key position to put that secondary patch. And it's pretty immediate. Within 10 seconds after getting the patch placement where you want it, you're going to go, wait a second, my pain is gone. That's crazy. And we hear that once again every time we put it on somebody. They're like, whoa, 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 time out. Take the patch off. They're like, ow. Put the patch on. They're like, whoa. So that's how that's applied. It's a two patch system. The X39 is just one singular patch. The Ice Wave is to treat pain. So it is a patching system where we kind of surround the points of pain. Once we are able to identify that placement, it is super effective. It's a patch that we can say, hey, for the next 24 hours, keep that patch on your body, and we'll see you again for therapy in a day, and we'll revisit this.
Okay. So Tamara froze up a little bit.
Oh
So
no.
I apologize for that. But what we will do is I'll just continue on with, oh, there she is. Okay. So once we toggle that around, we find out that that's the hot spot as far as relieving that pain. I know for me, I tell people 75% or more. Like if I'm not really reducing your pain by at least 3/4 of what it is, and their jaw will drop and they look at you like, what have you just done? It's incredible to, for two people that we treat pain every single day, it's amazing to see what that patch is capable of. And so let's tie those two together to kind of finish this discussion. But
Okay.
some people think that ice wave is like that's the fix. Like we know as therapy, PTs and PTAs that if I can get somebody to decrease their pain and start to be able to move in a normal movement without compensation, without flaring things up, then that is a huge jump towards healing. So
Absolutely.
knowing that ice wave is that's the purpose, how do we what's the fix? Like, is ice wave the fix or do we need to do other things?
Yeah, so, ice wave is a temporary solution to a problem. So it's going to eliminate the pain. It's going to help us move with better function. It's going to help us decrease some of those aggravating circumstances that are maybe creating the pain, but it's not solving the problem. If we are continuing on with the X39 patch on a daily basis, those chronic pains that we need that ice wave for are going to start to resolve gradually. We don't get to dictate how that process happens or the time frame in which that process happens, but in my experience so far with the X39 and the ice wave patch combined, I'm patching my pain so that I can move better, and then I'm using that X39 every day so that I can start to eliminate that reason for the pain.
Awesome. Very good. So I would leave this if you all have further questions, please reach out to us. You can find us at Oklahoma Hand and Physical Therapy on Facebook. You can find us through Moving into Wellness. Tamara's our wellness director, and certainly we do a lot of things that are kind of cutting edge that you're not going to find other places to help alleviate some common conditions. And also following those pages on Facebook is huge because we put out regular information on wellness and things we can all do to live, better, move freer, have less pain, more energy, better sleep. The list goes on and on. So I encourage you to follow us with those things.
That's what it's
Tamara,
about.
thank you.
Thank you. Moving into wellness, we can all do it together. So easy.
Awesome. That's right. All right, everybody have a great night. I appreciate you tuning in today.
All right, bye guys. See you
Bye-bye.
next time.